This is skill 2.21, preparing medications from ampules. Okay, so what are ampules? They are either clear or brown glass cylinders that hold medication. Can you see the medicine in there? Okay, see that? That's an ampule. Okay, so you're going to do all your necessary work to get the medicine from the storage, all that other fun stuff, okay? So now we are at the point of we are going to be preparing it. Okay, so we're in the med room. We've taken it out of the AccuDose or the med dispensing or the storage area for this medication. We've looked at it, okay? We've looked at the name of it. We've looked at the dose, make sure it's the correct dosage. We've looked to see if there's any floating particles in it. Okay, because we don't want to give anything with floating particles. Ew, right? Yuck. Okay, so we look at all that. We also look at what? Right, the expiration date, okay, because you don't want to give an expired med. Okay, so you're going to look at the expiration date. We're going to wash our hands, and we're going to gather our supplies. So what do we need? We need this thing called a filter needle. Okay, and you have to look at the needle and you have to say, oh yep, it says filter needle. It has a micron filter within it, within the filter, within the needle itself. And what it's going to do is it's going to filter out any fine particles of glass that may be in the medicine when we snap off the top, okay? So you have to use a filter needle with an ampule. Anytime you're taking medicine out of an ampule, which is a glass cylinder with medication in it, you have to use a filter needle, okay? All right, so you need the ampule, you need a filter needle, you need a syringe, and you need a regular needle, whatever it is that you are going to be administering. Now, if this was a med to be administered in an IV lock, okay, so you're going to be IV pushing it, you wouldn't need another needle. If this ampule medication was for a sub-Q, you would need a sub-Q needle. If this ampule medication was for an IM injection, you would need an IM needle, okay? Simple as that, right? Okay, so first of all, you're going to have the filter needle, and you want to take the filter needle and put it on your syringe, okay? Your syringe is generally going to be 3 cc 3 milliliter syringe, okay? Because normally ampules aren't that big and will hold generally between 1 to 2 milliliters of fluid, okay, of medicine, okay? All right, so if you look, can you see how the med is just floating around in there? Now the top may look like it doesn't have any med in it, but it really does. What we want to do is we want to flick it like this and get all of that med down inside the container here. So this is full of air now and not medicine. Now, if you look real closely around here, right around in here, it's been scored by the medicine, by the pharmaceutical company, okay? So it make it easier to open. And so you're going, oh, how am I going to open that without cutting myself? Well, you got to be very careful when you do this. So you generally, when we do open it, what we're going to do is we're going to snap it away from us. Okay, so we want it to break here. So we want to snap it away from us. So you're going to take your finger, you're going to put it on the back of the vial towards you. You're going to put your thumb on the back of the vial where it's going to break. You're going to put your finger on the top here and you're going to snap. So you're going to bring this finger towards you, okay, so that this is breaking away from you. So you want to do this in the med room. You don't want to do this in front of the patient, because if you're snapping it away from you, what are you doing generally? You're snapping it towards the patient. You don't want to do that, okay? So you want to do this in the room, okay? So you're going to take an alcohol pad. You can take the alcohol pad unopened, put it over the ampule itself and snap, okay? You can open up a corner of the alcohol pad and put the and open it up like this. See how I've got it open a little? Can you see? Okay. Oops, it didn't open. No wonder you couldn't see. All right, so we want to open that up. All right, see how it's open like that? And what we do is we can just put it right on top of the whole ampule. See the ampules in there, right? So I'm going to do the same thing. I'm going to take my thumb, put it on the back and on the top, and snap it away from me. You can also use, I'm trying to show you all different things, okay? You can also use a gauze pad, okay? You can do the same thing with this. You can use it unopened, okay? Put it around this and snap it, okay? What I'm trying to tell you is that you want to put a barrier between your fingers, your skin, and this glass, okay? Use something as a barrier, okay? I generally use the alcohol pad like this. I put it on and I snap. Click. Just like that. Did you hear that snap? And you see the top is now off. The top is inside of here. This is now a sharps. It goes in the sharps container, okay? Then you're going to put the medicine right down on the counter just like this. You're going to uncap your needle, okay? Let me move the camera so that you can see how I'm doing it while it's on the counter, okay? So hold on. I'm going to pause it. Okay, so here's the ampule. You see the top is off of it, right? Okay, and here's my needle. I'm going to uncap, and this is my filter needle. Whoops, this is the filter needle, okay? What you're going to do is you're going to insert it into the middle of the ampule without touching, okay? Without touching, and you're going to draw up all of the medication. Draw it all up. Now when you get towards the bottom, you may have to turn the ampule to finish drawing up the medication that's in there. So draw it all up, just like that, okay? Whoops, just like that. Drop all the medication. Okay, want me to show that again? All right, so we get towards the end. Okay, it's not drawing up anymore. What we do is we turn it on its side and finish drawing up the medication. Draw it all up, okay? All right. So now we put this ampule to the side, okay? Then we're going to snap the syringe to get the air bubbles out. Okay, snap it. And then you're going to push up on the plunger to remove all of this air, okay? So you push up on the plunger. It's okay if it leaks out just a little bit because there's some medicine in the needle itself, right? Okay, so now and then you're going to snap it again to make sure there's no air bubbles in here. And what you should have in your syringe, okay, is how many milliliters was in your ampule. So I don't know if you can see. Wait a minute. Can you see that 2 milliliters? I don't know. Can you see it? I'm trying to make it so you can see it. It's hard. There we go. Oh, whoop. See how it says 2 milliliters, right? Right? Okay. So if you look, I haven't put the cap on because I'm not there yet. If you look on the syringe, it's at 2 milliliters. Okay? All right. So now we have this ready. We have all of the air up towards the top, right? Okay. So now what we want to do is we want to recap the needle. And in order to recap the needle, you're going to leave the needle cap on its side on the counter. And then you're just going to scoop that needle into that cap, just like that. Okay? Again, the cap is on the counter. Trying to make it so you can see it. There we go. It's on the counter. You take and scoop the cap onto the needle like that, okay? And then you can push it down onto it, okay? These needles these needle caps, some of them you can set up on itself like this so that they sit, and you can put the needle down inside of it. Okay, some needles will do that. Okay, so we don't want to use this. Remember, this is a filter needle. Okay, so we don't want to use this filter needle in order to do our injection. Okay, because there might be fine particles within this of glass, and we don't want to put glass into our patient's body. Okay, so what you want to do is you want to get your needle that you're going to be using, whether it is IM or sub-Q. It's dependent on what needle you're using, right? And you're going to remove, so you just turn that filter needle right off of there. Okay, see, it just comes right off of there. That's going to go in the sharps container, and then we just take our new needle and we push it on. Okay, now that we have it on, remember there's 2 milliliters in here, but let's say that the doctor only ordered the dosage that would be equivalent to 1.5 milliliters. Okay, so what do? Well, you take and you're going to expel up to 1.5 milliliters, and you're going to do that into whatever is appropriate for your facility to waste medications into. Okay, I'm just going to use this this syringe paper here just to show you. Okay, but what you do is you uncap, don't twist, because we don't want to take the whole needle off. Okay, because we want to put medicine into the needle, right? Because we're going to be injecting it, so we don't want to inject air into our patient. We want to have that needle on when we waste the medication. Okay, so just pull the cap off. Okay, see, we just pulled the cap off of the needle. All right, and then what you're going to do is you're going to invert the needle, so you're going to down, right? And you're going to push the plunger, so this is the plunger. You're going to push that slowly until you get the stopper to the 1.5. Okay, there, and I have a little air bubble, so I'm going to push that to the top. There we go. Get rid of that air bubble. Okay, and I'm going to get that medicine to 1.5 milliliters. Okay, I'm going to recap. Remember, scoop the cap onto the needle, right? Scoop it. There. And now this is ready for administration into our patient. But remember, I'm in the medication room, so I have to carry this medicine to my patient. Okay, now if you need to scan the ampule that you just took the medicine from, you're going to have to make sure you bring this ampule with you. Okay, but you definitely need to label this medication, because it's drawn up into a syringe, and if you were to place this down, you wouldn't know if you place it down because it was a code situation or emergency, somebody fell and you went to go help them up, and you placed this down and you had 2 or 3 of them, which one is which, right? Okay, so you have to make sure that you label it. And how do we label it? Well, it's as simple as a white label, piece of tape. You can use a piece of tape as well. Okay, and you want to make sure that you put the medication, the dosage, the date, the time, and your initials. Okay, so you just take that, whether it's tape, a pre-made label that your facility uses, okay, and you want to put it onto the syringe. Now, you don't want to block where, you don't want to block where the medicine is, okay? You want to label below where the medicine is, okay? So you could do this and feed it onto itself, okay? Meaning put the 2 sticky sides together, okay? So now my medicine, my syringe is labeled with what my medication is and all that. So you want to make sure that you label every syringe with medicine in it, okay? So then, if your system, if your facility requires you to have the ampule to scan the barcode that's on there, you would take this with you to your patient's room along with the medicine. Okay? All right. So that's preparing medications from ampules. Now, as I was doing this, I realized that maybe you don't know how to read a syringe. Okay, so let's go over that real quickly. Oh, no, I'm going to do another video for that. So look for that, okay? So this is skill 2.21, preparing medications from ampules.